On March 13th, it will be 1 year since nursing homes were locked down and residents were prohibited from having visitors. Tens of thousands of residents and their loved ones have not seen each other for almost a year. As a result of the lockdown, residents are suffering and dying from neglect and abuse. Chronic nursing home understaffing that predated the pandemic has combined with families not providing care to create a nightmare scenario where residents are suffering daily. We have spoken with countless family members ready and willing to go into nursing homes and safely provide care. Estimates show that there have been over 40,000 excess deaths in nursing homes during the pandemic that are not attributable to COVID. The suffering must stop. It is time to safely reopen nursing homes and reunite residents with their loved ones. In the following video, you will hear from Annette Keehner. Annette's husband, Daniel, is in a VA nursing home in the Bronx. Before the pandemic, Annette drove 2 hours to and from Brooklyn to visit her husband. Now she is prevented from caring for him and being with him. Married for 47 years, Annette has had to sit helplessly while her husband has lost over 40 pounds and declined mentally and emotionally. Annette and Daniel are not alone. There are tens of thousands of residents and families suffering because of the visitation ban. We must end the lockdown and reunite residents with their loved ones.
Watching my husband die a little bit every day, and he doesn't even know that. And if something happens to him, I'll never be able to recover from the fact that he thinks I've abandoned him. And I feel like he's slipping away a little bit at a time every day. And can you imagine not even knowing that anybody cares about you? And you're just sitting there, they don't know why he's losing weight.
My name is Annette Keehner, and I'm from Brooklyn, New York.
That's good. And where's your husband?
My husband is in a VA facility, a federal facility in the Bronx, almost a 2-hour drive from our home, with traffic at least that. And there's lots of traffic in New York.
It's a veterans facility because he's a veteran?
Yes. Dan was in the Marine Corps from 1966 to 1970. And while stationed at by Parris Island and Camp Lejeune for basic training, there was a toxicity problem in the water there, and he contracted Parkinson's disease because of that. November 22nd, we celebrated our 45th wedding anniversary. I shouldn't say celebrated because we didn't get a chance to, but 45 years now. And my grandchildren have seen him on FaceTime calls, but he does not respond. He doesn't understand what's happening, that we're live. He thinks he's watching a video of us, and it's very upsetting, but at least I can see his condition, which is very disturbing. Prior to the pandemic, other than the 2 days a week that I babysit for 2 of our grandsons, I was with him for 5 days a week from right after breakfast until after dinner. I was part of his, I was hands-on part of his care every day. I'm his wife. I'm the person that cares for him more than anyone else on this earth. And he'll tell me if there's something going on with him, or sometimes he doesn't have to tell me. After all these years, you just know your partner. I know when something's not right with him. I feel he's slipping away from me, and I'm sorry.
It's okay. Take your time.
I'm watching him die slowly. He's dying from isolation. There's so many others like him that are going through the same thing across the country, and it's just criminal. My husband has a private room. If they would let me in to be with him, it would take the stress off of them for his care. It would take the heartache off of me, and I'm sure he would start gaining weight again. How
much weight has he lost?
He's lost 44 pounds in 11 months. At one point, he told one of the recreation staff during our chat, don't pay attention. She divorced me. She's married to someone else now. He's so confused.
And that's so hurtful to me to think that my husband thinks I abandoned him. It couldn't be further from the truth. You know, my husband is one of 5 siblings, and at the end, his mother was in a nursing home, and he went to see her every single week at all the years she was in. This is not a man that anybody would just abandon. He never abandoned anyone in his family, and I could never abandon him. We can't live without each other, and it's killing the both of us. And they just recently sent home his wedding ring because he lost so much weight. It was falling off his finger and he was playing with it and they were afraid it would get lost. So he doesn't even have that. He always holds his wedding ring when he's sitting in his chair. I think it's his connection to me. Now even that's gone. He doesn't have it on his finger anymore. And I'm sure if you lost 44 pounds, your fingers would be so thin. I just see him slipping away from me, and I'm terrified that I'm going to get a phone call one day that he's in, and he's in physical distress, and I'm not there to do anything about it. I don't want my last visit with my husband to be in some kind of a hospice situation.
If they said, come in tomorrow, would you be willing to wear PPE?
Absolutely. My daughter told them that she would get me a hazmat suit. Her husband is a critical care paramedic, and he's licensed to be on helicopter rescues. She wasn't kidding. She could actually get that for me.
What about being tested? If they required you to be tested twice a week?
Absolutely. I told them whatever the staff does, I would be willing to do. Just tell me what you need from me in order for me to be with him. And they say it doesn't matter. It doesn't matter if I have the vaccine. It doesn't matter if he has the vaccine. It doesn't matter what I tell them I'll do. They tell me that they don't make the rules. They are not allowed to let visitors in.